commitment in enhancing the quality of healthcare we have in the West African sub-region through strategic partnerships, access to quality and affordable medical equipment, knowledge-sharing conferences, we present to you another mind-blowing segment, Hospitals in Focus. The Health Pulse magazine, under the health community of West Africa, is proud to present to you an insightful segment that throws the spotlight on healthcare facilities in the region. With this, we present to you their unique story, their challenges, their motivation, their innovations, and we do a bit of industry analysis to find out what is happening in the healthcare sector across the region. Today, we are at MAB International Hospital, located at Dakuma in Accra, Ghana. Come, let's find out what is their unique story. Hello everyone, welcome to Hospital in Focus. Today, we are privileged to have with us the Executive Director of MAB International Hospital. Let's get into the conversation. Hello, sir. You're welcome.
Thank you very much.
Kindly tell us about yourself.
Well, my name is Wapari Komabuatim, the Executive Director of MAB International Hospital, as well as MAB Medical Center. It's a group of companies. So we have MAB International Hospital, MAB Medical Center, and then we have a training school, which is MAB Health Training Institute as well.
Okay. Tell us, what is the story of MAB International? How did it start? And what has been your motivation so far?
Okay, so MAB International Hospital has been in the system for about 10 years. Okay. And like I said, it's a group of companies, with MAB Medical Center being the mother of all the companies. The group started with MAB Medical Center back in 2001. Our late founder, Dr. Jacob Ekomamboatin, the late, was the founder of the MAB group of companies. He started with MAB Medical Center about 150 meters down the street, just from this location. Yeah. And then it grew. He decided to acquire another facility, which was Begavest Medical Center. And that was also at a North Industrial Area. And then later on, he secured this land. So, he has had this passion for medicine right from infancy. And what he went through during his childhood, he believed that no child should go through that. So he decided to build hospitals, expand, and then ensure that everybody have access to healthcare. So that was the main reason why he decided to build this facility. And like I said, right from the outside, we saw how the place has been growing, and this is not the last of it. We intend to expand and partly have other branches as well.
Okay, that's nice. You mentioned his experience growing up as a child. So there, I'm tempted to ask, which of your services are you most known for? Is it in the pediatric care, is it maternal units? Which of your services?
Okay, so mother and child has been one of our dedicated departments. We really have this passion for children and then our mothers. So pediatrics is one of the main departments we invest and focus into.
Okay, so aside pediatrics, list the other services that are provided by MAB International Hospital.
Okay, so we operate 24 hours. That's the first of it. The general OPD, we have inpatient department as well. We have 24-hour ambulance services. Our laboratories operate 24 hours as well. The pharmacy, and then we did general and then specialized surgery, pediatrics, like you said, radiology, diagnostics, which is the scan department, X-ray. We have all those services available. We are, in about a month time, we are opening our ultramodern dental unit, and just next week as well, we are opening our audiology unit to the public as well. So there are a lot of things coming up. Latest by May, and then as well, our dialysis center should be opened to the public as well. So these are few of the services. And we have partners whereby when we are not able to handle some of these things, and right here, we have partners in Ghana that we sometimes refer to, and if not in Ghana, we refer to outside as well.
Okay. So other health facilities that you work in line with in case you're unable to solve.
Yes.
Okay, so let's come to the technological aspect of it. What are your key innovations in this facility?
Okay. So, like I said, we have the X-ray department. The X-ray is one of the uh, tools that we use in diagnosis when it comes to imaging. Uh, we are currently trying to acquire an ultramodern MRI and then CT scan as well, and that's also in the pipeline. We are not done with that yet. The structure is in place. There are one or two things that we'll need to finalize to get the MRI and then the CT scan available. So the scan machine we have is a 4D scan machine, which is one of the latest in the country. So, if not all in Mark or just about 2 or 3 people should have that. 2 or 3 facilities should have that. It's one of the machines that gives how do I call it? The imaging, the quality, and everything is very good. And it's 4D. When you say 4D, you should understand what it is. So yeah, at MAB, we try to get the best for our patients. So these are a few of the things that we have currently. Our laboratory machines are also the latest in them. So and these things that we have currently are all geared towards the delivering of service, quality service to our clients.
That's nice. Let's come to patients' care. There are lots of private health facilities around. So can you enlighten us? What is unique about MAB International Hospital when it comes to patients' care?
Okay. So at one international hospital, our patients do not wait in line to see the doctor. We always ensure that not less than 3 doctors are available at any time during the day. But for nights, we have 1 or 2 doctors because the traffic is very slow. So when it comes to mouth, we have a protocol that within 10 minutes, we should see a doctor. No matter what it is, you should meet a doctor within the next 10 minutes after you've checked in at the records department. So we check in and then we ensure that the OPD nurse also takes some vitals and then they usher you to the consultation room to see the doctor. At our general wards, we have much more than 6 beds. It's a very spacious place, not more than 6 beds. And then we have our nurses in the ward just to ensure that whatever you need at any time you call a nurse and they are readily available to attend to you. Our pediatric unit is also well spacious and the kids are always happy where they come in. Some feel like they're at school because the setup and everything gives them the feeling that they are not in a hospital. You know, for recovery, you would need to have something that takes your mind off the hospital, whereby you don't feel intimidated by other things that will be around you. So basically, we always try our best to ensure that when our clients come in, they you know, hospital care is just like hospitality industry and the hotels and all this. For you to come to a hospital, we should also feel like you're just going away from home, but then we should feel at home. You understand? So we ensure that all our clients come in and they're very comfortable. When they have issues, we have dedicated people who, at any point in time, there are numbers around that you can always call, and then within a shortest possible time, no issues are addressed. So we do take care of our clients very, very well. Very, very well. And we've had a lot of issues. We've had a couple of government people coming all the way from outside the country just to see my catch.
Okay, so well, it's an international hospital and we have international clients. Are your services affordable?
Um, Very affordable. You know, most private institutions or hospitals don't accept the national health insurance
Okay.
card. But for MAP, right from the beginning, one of the dream that our late founder had was to make healthcare very affordable to every individual. So, and at times that's the going gets tough. You may think that, oh, you should switch to the cash and carry services or with the private insurance house. But he said no. The dream he had when he started this hospital was to ensure that every Ghanaian or African or even anybody in this world who wants to access healthcare should be able to work into MAB and then ensure that no matter what the pricing may be, they should be able to afford. So to tell you the truth, our services are very affordable.
Very affordable.
Very, very.
Okay, nice. So, as part of affordability, which was cutting down costs for patients, what are other community initiatives that you are doing to support the community that you are in, or any corporate social responsibility projects that you are taking on?
Okay. So just last week, we were at one of the orphanage homes to, I wouldn't want to mention the name for Paris and confidentiality. We were at one of the orphanage homes where they screened all the children available for free. And then their caregivers, we took care of them. And those who had issues, we provided medications to them. Those that we couldn't handle at the site, we had to refer them, right? So the ambulance brought them here. And then our doctors here took care of that. So these are things that we do from time to time. With the business development department has made it a target and not less than one health screening, free outreach is done every month. Every month. So we ensure that every month we go into the community, we screen them, we provide advice, not just the basic screening. We provide ELT services, optical services as well to them on the field. And this comes freely. So if they have to be referred to the hospital, it comes at a discount. So these are things that we do to ensure that the community, you don't need to work in here, but then sometimes we also come to you and then provide these kind of services to.
Services. Okay. And then we would come to challenges. We know every business faces a challenge one way or the other. So, what are your challenges when it comes to healthcare in Ghana?
Yes. So like I was saying, we have decided to make our services very affordable to the ordinary dining. So sometimes we provide these services. We have partners, private insurance partners, and the NHIS is a partner. The National Health Insurance Authority is also a partner because they are accredited by them. And then sometimes you provide services, and then the issue of reimbursement becomes a challenge. If you decide to go the cash and carry way, these are people, and the online Ghanaian is someone who will not be able to afford services when we run on the cash and carry basis alone. So sometimes reimbursement from these partners becomes a challenge. We are not able to get adequate funding to provide the services that we need to. So the major challenge is funding, where we are not really into this business for profit, because like I said, our founder decided to ensure that every Ghanaian or the ordinary person is able to walk into this facility and then access healthcare. So when the little that is due us is also
Taken away by the partners.
not really taken out, it's sometimes delayed.
It's delays. Oh, okay.
Yes, we have a contract with them where there are some have to reimburse by 30 days, 60 days. And sometimes it goes 120, 180 days. And then we're not able to, how do we operate when your money is stuck somewhere with someone? But 180 days. So these are the challenges that we encounter in this industry. Unless you want to go, some of our competitors, I don't want really use the word competitive, but others only run on the cash and carry. With only private insurance that we invest on time. But we don't do that. We always try to ensure that everybody is able to walk in that same edge. I say so.
Okay, sure. So, let's look at future plans. What does the future look like for MAB International Hospital?
Okay. I always mention the founder's dream. It was his dream to establish an ultra-modern cancer research center. Now, cancer is one of the diseases that has um, that is really on the rise in the country and then in the world time. And then, despite research and others, we've still not been able to find a cure to cancer. You understand? So it was his dream to ensure that we get MAB gets an ultra modern research center whereby we can also go into research for cancer, especially, and then see if there's anything that can be done when it comes to research. So yes, plans are underway. It won't be here. There's a dedicated area for it, and then we are looking at it. He's been looked for about 4 years, but then the dream's not dead. We still want to ensure that that dream lives and lives on. So that's the key priority of of ours now. In the interim, we are making plans to ensure that we get a CT scan that I mentioned, that the MRI. We are done with the structure and all this, but it's just like some 1 or 2 things that need to finish, and then we take it from there.
Okay, so you're bringing our conversation to an end, and we are looking at the healthcare in Ghana, in Africa, global perspective. How is it looking like? What are your general opinion?
I would say there's hope. Let's go back to late 2019, early 2020, when COVID hit the country. We found ourselves wanting. It was really an issue whereby we couldn't, as a nation, there were places we couldn't provide basic healthcare to most Ghanaians when the issue of COVID-19 came. Tertiary institutions were choked. There were places that they had to, in the interim, convert as health centers to take care of these people. But then I believe that with the initiative of what the past government did in the Agenda 111 project that was started, and it expands and the accessibility to healthcare. And then with our current president, President John Mahama, assuring the nation that they will continue with this project as well. And so if about 111 projects or hospitals is also coming on board, I believe that healthcare will expand and then it will be accessible to the ordinary Ghanaian. So there's hope. I believe there's hope.
Yes.
Now it's here. We will also be expanding. We will be. The plans are mean. The plans are mirroring. We are just not here. We have other branches, like I said from the beginning. There's one situated at Ablekuman, the block factory area, and we had one at North Industrial area as well. Makani, that's branch is closed, and then but we intend to expand in the near future. So that's all. That's all for Ghana and Africa as well.
Okay, sure. So on the notion that there's hope for healthcare in Ghana and Africa, we bring this segment of Hospital and Focus to an end. Thank you so much for your time.
Thank you, sis.
MAB International Hospital, home of God's mercies, admonitions, and blessings.